I don't know what you said, but thanks for today's forecast.
I stumbled on the dismount. Over to you.
All right. Well, still good. Thanks so much, Tucker. Well, your time now is 9:33. Last week, health experts shared a new study that shows the Delta COVID-19 variant produced similar amounts of virus in vaccinated and unvaccinated people if they get infected. This led to some local and federal guidance that now recommends most fully vaccinated Americans to wear masks indoors. Chief Scientific Officer at the Association of American Medical Colleges, Dr. Ross McKinney Jr., joins us now to explain more. Good morning to you, Doctor.
Good morning, and how are you?
I'm great. Thanks for joining us today. Let's start in a general sense here. What's in that study about the Delta variant that has since changed guidance?
So the change was there was an outbreak that occurred in Provincetown, Massachusetts. And what was striking was that the people who got infected and were vaccinated, because most of the people in Provincetown were vaccinated, they had the same amount of virus shed that the people who did not have vaccine. Now, the difference in how many people got infected was enormous. People who were vaccinated are much less likely to get infected at all. They're much less likely to get sick or hospitalized, but if they happen to get infected, they'll shed just as much virus. And with the earlier strains, that wasn't the case.
We know that if you do get infected with the COVID-19 and you have the shot, you are less likely to suffer from severe illnesses. But are you seeing any commonalities among the people who are vaccinated who come down with the virus?
Well, the people who do come down with the virus are likely to get symptoms. In that Provincetown study, the CDC study, about 80% of the vaccinees who got infected had symptoms. And they were the usual sort of COVID symptoms, a little congestion, headache, maybe low-grade fever, and loss of smell, sense of smell. And so if somebody gets infected, they're likely to get symptoms. However, the symptoms appear to be shorter in duration, and the length of time that they're shedding virus appears to be shorter in duration.
I had a couple of our viewers reached out to me asking if the type of shot or vaccine you receive, does that have any impact on how your body reacts to the Delta variant? Are you seeing a difference between the three vaccines?
Well, there's unequivocally true that the two mRNA vaccines, Pfizer and BioNTech, and the Moderna vaccines, both of them are very, very effective. The Johnson & Johnson vaccine is also effective against severe disease, probably a little less effective against getting infected. But both of them, both categories, both Johnson & Johnson and the mRNA vaccines are effective. And we don't yet know. Some people like to get a booster if they've had the Johnson & Johnson. We don't know if that's necessary, but it's some people are doing it.
Doctor, I wanted you to speak to critics out there who have not gotten the shot and don't plan to. They're now looking at this guidance and saying, well, see, why get the shot if I'm going to have to wear a mask anyway? What do you say to those folks?
Well, it wasn't just about not wearing masks. It was about not getting sick and dying. So the case fatality rate for unvaccinated people with COVID over the course of the epidemic is about 1.5% to 2%. So if you had a 1 in 50 chance of dying when you crossed the street, would you cross the street? If every 50 times you crossed, there was a very good odds that at some point you were going to get hit and killed, would you do it? And so the protection against serious disease is real. It's meaningful. And for those people who manage to survive crossing the street, who are not in that 1 in 50 who just die, a lot of them will end up with long COVID symptoms, weakness, headache, fatigue that persists. And some of them have been hospitalized for long periods of time. So the bottom line is you are protecting yourself and you're protecting others because you're much less likely to get infected at all if you've had the vaccine.
A few seconds left here. What do you see in terms of changes as we move into the fall with this Delta variant? Anything major?
Could go either way. It could continue to spread, or we could do like the UK, where in fact their rate of infection suddenly fell off precipitously. So we could cross our fingers. We have the British experience, but there's still a likelihood that we could see an increase in unvaccinated people getting infected in the fall.
All right, Dr. Ross McKinney Jr., thanks so much for your time and expertise. Take care.
Thank you, and have a great morning.
You as well.
Great interview. All right, Marissa, thank you.
Brand new wheel, just
9:30.